Assalamualaikum warahmatullahi wabarakatuh. Hey everyone, how are you? Fine, right? If not, I hope you get better soon. Okay, I made this video to complete the PKKMB assessment, which is an explanation of the medical poster in English. First, let me introduce myself. My name is Aulia Alifa Fuada, and you can call me Lia. I'm from the undergraduate program of Applied Medical Laboratory Technology, and my name is P071342222044. So in here, I will explain to you about my HIV/AIDS poster. I hope that my explanation can be understood and applied well to you all. Before it, I apologize if my explanation is not good, but I hope you can understand it, because my English skill is not good as Justin Bieber. Okay, let's get started. Do you know about HIV/AIDS? Are they two things different or they are one unit? Okay. HIV or human immunodeficiency virus is a special type of virus that causes serious illness commonly known as AIDS. So, HIV is the virus, while AIDS is a disease caused by HIV. HIV attack part of the human immune system that calls CD4 cells, so that the body loses the ability to fight infection from various bacteria and virus that try to attack our bodies. CD4 itself is a white blood cell that plays an important role in fight infection and disease that threaten the body. A person exposed to the HIV can survive without treatment for approximately 8 until 11 years after infection. AIDS, or acquired immune deficiency syndrome, is a collection of symptoms due to deficiency or weakness of the immune system caused by the HIV. If the immune system is severely damaged with a CD4 count of less 200 or 14%, it is considered AIDS. However, if the CD4 count is still within normal limits, it is not considered AIDS. So, it can be concluded that someone who is infected with HIV is not necessarily AIDS, but if someone is declared infected with AIDS, it can be ascertained that he is infected with the HIV. The Ministry of Health of the Republic of Indonesia estimates that HIV cases in Indonesia will reach 543,100 people in 2020. And I quote from the official website of the PKS Infection, the data on contributor of HIV cases from sexual deviation continues to increase. According to UNAIDS data in 2019, the population of new HIV sufferers from MSM or man-sex man and transgender circle reached 18%. Pretty surprising, is it? Moreover, in recent years, LGBT has started to appear on the surface and has begun to be considered normal by some people, and there are even many who support this abnormal relationship. There are several risk factors that make us able to contact with HIV/AIDS, starting from sharing needles with people who are contaminated with the HIV or using needles repeatedly. This is common, the process of making tattoos and piercing. Second, free sex or unprotected sex on the condition that there are open wounds in the sexual organ, mouth, and skin. Most cases of HIV due to casual sex occur in adolescents because the vaginal membrane is thin, so it is more susceptible to abrasion and injury than adult women. 3. Pregnant women with HIV/AIDS can transmit the active virus to their babies before or during birth and while breastfeeding. Even so, keep in mind that a person will not be infected with HIV/AIDS just because of daily contact such as shaking hand, holding hand, hiking, coughing and sneezing, donating blood in a safe way, sharing eating utensils, and sharing bedlines and towels. HIV symptoms are divided into 3 stages based on the progression of the disease. Stage 1 is acute HIV infection. Symptoms at this stage appear 2 and until 4 weeks after infection occurs. Patients generally do not realize they have been infected with HIV because the symptoms that appear are similar to flu symptoms, such as fever to chills, rash appear on the skin, vomit, pain in joint and muscle, swollen limb, nose headache, stomach ache, sore, threaten and tooth, and stage 2 chronic HIV infection. This stage can last for several years. The symptoms that feel are weight loss, sweating at night, cough, diarrhea, nausea and vomiting, herpes zoster, swollen, lyme nodes, headaches, and fatigue. Stage 3 is AIDS. At this stage, the immune system is damaged because in the second stage it is not handled properly. Symptoms are weight loss for no reason, sweating at night, white pits on the tongue, mouth, genital and anus, purple spot on the skin that won't go away, fever that lasts more than 10 days, chronic diarrhea is infection in the mouth, throat or vagina, swollen lymph node in the armpit, neck and groin, nervous disorder such as difficult concentrating, memory loss and confusion, easy breathing or bleeding, body feel tired easily angry and depressed, rash or spot on the skin, hard to breathe. There is cure for AIDS, therefore we must avoid contracting HIV/AIDS in several ways, such as being faithful to a partner or not changing sexual partner, using disposable syringe, avoiding drug use, especially through needles, male circumcision, providing education about HIV/AIDS as a whole to the community. Okay, I think this is enough for my explanation. Hopefully it can be understood well. If you really understand the explanation I give, it means you know how dangerous HIV/AIDS. If you are not sure what I'm saying, you can look it up yourself on the internet. How dangerous HIV/AIDS, how to avoid getting it, and what the symptoms are. Stay careful everyone, say no to free sex and be patient. Everything has its own time. I hope everyone stay strong, okay? Alright, that's enough. If there are errors in the delivery and the language I use, also the messy grammar, I apologize. Wassalamualaikum warahmatullahi wabarakatuh.